everybody. Hello, Hope for HIE community. We are officially live. I am Deanna Bryan, the program manager at Hope for HIE, and I am joined here today to talk about the relationship of between sleep and HIE with Dr. Renée Shellhaas. Thank you so much for joining us today. She is a pediatric neurologist and researcher from Washington University in St. Louis and is known for her research and clinical expertise in managing neurological conditions in newborns, has made significant contributions through her work with the Neonatal Seizure Registry. And most relevant to today's conversation is her research in understanding long-term outcomes and sleep patterns in children who experienced neonatal seizures. So thank you so much for joining us. I can't wait to get started and talk to you about this really prevalent issue that a lot of parents have brought up in our forums.
Thank you so much for inviting me. I'm glad to be here.
Of course. So I gave a brief background, but it doesn't really quite do justice to all that you've done and accomplished. So if you don't mind starting off this Q&A just with an introduction of who you are, a brief career overview, including your journey to becoming a pediatric neurologist and your interest in studying sleep issues in children with HIE.
Sure. So once again, really glad to be here. And yes, I'm a pediatric neurologist. I'm trained as a pediatric epilepsy specialist. As early on in my residency and fellowship, I was really interested in newborn brain monitoring and did work. My first projects were around seizures in newborns. And obviously, HIE is the most common cause of seizures in newborns. So I was quickly linked in with the HIE research community. But I was interested not just in EEG monitoring and seizures, but how overall could we monitor the brain of a baby, and started looking at near-infrared spectroscopy, as that was a relatively newer technology at the time. And in one of my first studies, we saw these patterns of cycling on our near-infrared spectroscopy data, and I took that and brought it to the head of the sleep program. I was at the University of Michigan at the time and said, gosh, the only thing I can think of that a baby's brain would do on this pattern would be sleep. He looked at it and was just really interested. And he's like, you know what, we should write a grant on that. And so I never planned to be an infant sleep researcher, but you follow where your data take you. So that was sort of the birth of one of the research paths that I have pursued since then, looking at sleep as a marker of brain function for babies, and learning more and more as I go. So I think importantly, I am not a board certified sleep medicine specialist, but I am a child neurologist with very special interest in kids and families with HIE, and certainly my focus in part on infant sleep. So glad to be here to answer whatever I can about this really important topic.
And I also forgot to mention, you're a member of our medical advisory board too. So, you talk about that relationship between your work and now for Hope, we get to benefit from that. So we're grateful for your continued partnership and research. So we're going to get started. We're just going to start really exploring the relationship between HIE and sleep, because I know I've referenced, you have performed research on it. But can you begin by explaining why sleep issues are particularly significant or prevalent in children with HIE, as well as some of the common sleep issues that are present in that population, kind of defining what those look like?
Sure. So this is a really broad topic, but in basic terms, right? Mm-hmm. Sleep is fundamentally controlled by our brains, right? Our brains control when we wake up and as we fall asleep, and the cycling that happens in sleep, the stages of our sleep. But sleep is also affected by our bodies, our muscles, our lungs. And so we know that children with HIE have difference in their brain function, and that cause problems with falling asleep at the right time, staying asleep, and regulating the way that we breathe during sleep. And so there are a range of issues around those that are really stemming from the differences in the way that a baby or a child who had HIE's brain functions. Then there are also challenges around muscle tone differences. And kids with HIE may have high tone from cerebral palsy, for example. They may have tone that's different based on medications that they might take, either for their CP or for pain or for seizures or things like that. And muscle tone differences can make a difference in how we breathe, how we're positioned. And so that can also have an impact on sleep breathing and sleep apnea. And then a number of behavior challenges around sleep. And so depending on a child's temperament, depending on medical conditions, pain and things like that, depending on interactions with families, circumstances around where a child is able to sleep, do they have their own room? Are they sleeping in the same room as others? What are some anxieties that the child or the parent might have around their complex medical condition? So behavioral challenges certainly can play in as well. So it doesn't surprise me at all that families tell us often sleep is a big problem for our child. And then it's a matter of, okay, well, what aspects of sleep? Because it could be a huge range of things. And that may sound really overwhelming, but I think the most important piece here that I hope everyone will take home is, yes, sleep problems may be very common, but they are also very treatable. And so this is one I really feel like if we can move the needle and raise awareness, we may make really important impact for kids and their families.
Absolutely. And we're going to get into kind of what that research looks like to drive progress forward. But we, over the last couple of months, have really hit upon this theme of the importance of just patient family input and how it's kind of changing the landscape of research and how we're now working to prioritize the patient family experience and community input. And I know that as a part of, as a principal investigator in the neonatal research or seizure registry, you've been a huge part of that. So we're curious to know, what is your viewpoint? What is your stance on prioritizing that patient family input? And what are some of the primary benefits of incorporating that input into, let's say, your own research?
Sure. So first of all, I will say that patient and family input in research is a fundamental priority for the Neonatal Seizure Registry. So the Neonatal Seizure Registry is a group of 9 centers across the United States that I co-lead with Dr. Hannah Glass, who's also a member of the HIE, Hope for HIE Medical Advisory Board. And we have worked together as this really wonderful team over the course of about 10 years on topics of interest related to neonatal seizures. Importantly, we have a talented and invested site investigator from every one of those 9 centers, but we also have a parent who is affiliated with that center who helps to weigh in on what are research priorities, how might a study be best designed, how could we implement this study, gosh, if a family's having trouble engaging with the study, what could we do differently, how can we communicate results. They are authors on our papers, and so from soup to nuts for those individual parents. And then we are lucky to have some really wonderful additional leaders from organizations like Hope for HIE, like Hand to Hold, and Casey Circle, who also weigh in and provide that broader experience. Really, everything that we do, we make sure that we're checking in with our families as we go. And quite literally, when we were developing our study that ended up being funded by PCORI about how long should a baby take medicine after they have neonatal seizures, I went for a walk in the park next to the Children's Hospital in Michigan with the parent of one of my young patients who was asking all the right questions and just said, can we go for a walk? Like, we'll bring your baby and let's talk about what are the priorities and how could we work together to try to answer these questions. Now that we've done this for, almost 10 years with the Neonatal Seizure Registry, I can't look back. And any study that I participate in that doesn't have that really careful integration of parents doesn't feel right, and it's not as effective. So I I definitely think this is the secret sauce for our group and our success. And to be clear, as you sort of started to introduce this topic, this isn't my own research, right? This is team science. And for us, the team definitely needs to include parents.
Yes. So that's actually a great segue because back in March, I believe, Hope teamed with you, and we made a call to action to our community members to engage in a sleep survey. So we were so excited to kind of hear. First, we're going to start with like the goals and methodology of what the survey looked like, and then we'll get into key findings. So let's start with, what was the driving force? What's the impetus behind conducting this sleep survey? I'm sure you've kind of referenced that previously.
Yeah.
And what are some of the goals that you aim to achieve through this research?
Yeah, absolutely. So, we have heard repeatedly from you, from Hope for HIE, from other parents, that sleep is a problem for kids with HIE. And for a range of kids who had challenges in the newborn period. And so we've been starting to think about, okay, how could we delve into that? Because there's really a lack of data. And we knew that we had a model that worked well when we did our previous study that was, again, funded by PCORI, and that there was an opportunity to apply for additional funding. But we also needed to make sure that we were designing a proposal that would answer the most important questions. So I used a very similar kind of survey a number of years ago. A separate study that's now funded by the NIH, looking at sleep in infants with myelomeningocele. So that's a severe form of spina bifida, where we wanted to understand parents' research priorities and their experiences with symptoms of sleep problems and diagnosis and treatment for sleep problems. And so that had been very fruitful. And I approached Betsy as our fearless leader for Hope for HIE and said, this was really helpful to me when we were starting to conceive of a project for severe spina bifida. Could we do a similar thing with Hope for HIE to really understand, I've heard anecdotes, but to understand on a little bit broader scope, what is the experience around sleep issues? What are the priorities? Not necessarily focused only on sleep issues, but if we were to propose a study, how do families feel about it? And what are some things that we absolutely want to make sure that we address from a method standpoint and from a just overall, what are the goals of the research? So with Betsy's help and partnership, we refined that survey and were able to launch it with Hope, which is wonderful.
Wonderful. And for some of our family members who maybe participated and need reminding, or those who didn't participate, what types of questions were included? Like, what was kind of the scope that you can outline for them?
Sure. So we asked about, first off, what are your priorities for research? If doctors and researchers could answer some questions for you, what might they be? And then we asked about experiences around sleep. Do you have a concern that your child may have a sleep problem? Has your child been diagnosed with a breathing problem? Have your child been diagnosed with sleep apnea? Have your doctors or nurses ever asked you about sleep problems for your child? Have you had an evaluation? Have you had a sleep study for your child? Have you been treated for a sleep problem? Things like that. Mm-hmm. And so those were sort of the common areas. And then we explained at the end of the survey, we're thinking about a study where we'll be evaluating for how common are sleep problems, what kinds of sleep problems there are, and what might we do to treat them. If we were to do that, what do we need to know? Mm-hmm. Do you think that it would be useful? Would you be interested? Not that we were trying to enroll anybody in a study at that time, but just trying to get some initial feedback. So there were areas for open-ended responses and people who were some really great comments.
Yeah. And what was the community response rate like? And what are some of the implications, whether positive or negative, of that data collection that you've experienced?
Well, the Hope for HIE community response was fantastic. In just a couple of weeks, we had more than 200 complete responses to the survey, which clearly shows that you've built a community that is engaged and willing to participate in processes that give opportunities to participate in the research. As a researcher, that was, that was very rewarding to see. And the kinds of comments, the level of detail, the attention that people paid was really great. Now, we recognize that, more than 200 responses is a lot of responses, but there are thousands of people out there who are involved in HOPE. So this is clearly a survey of people who were motivated and happened to see the link, happened to think that this was an important topic. So there certainly is some bias in the results that we got, but it's also, it's important that we got to start somewhere.
Yes.
So I certainly wouldn't say this is, the be all and end all. It's the start of a partnership.
Right. Let's go ahead. I'm sure people are very interested to hear what are either the most surprising or the most significant kind of key findings that you explored from that response.
Sure. I'm not sure if it's surprising, but almost 90% of parents reported that they think their child had a sleep problem. That's a lot. And yet almost 20% said that no doctor or nurse had ever really asked them about it. And so you could look at it on the flip side, 80% of them, yes, somebody had asked, but 1 in 5 is too many.
Yes.
Fall through the cracks, right? Because if your clinical team doesn't know that there's a problem, there's nothing that it can do to try to help. And I think that's one of the themes that I hear from families is, sleep issues are common in typically developing kids too, right? But especially so in a child who's had HIE. And so just because it's common doesn't mean you don't bring it up, right? Because there are potential interventions. So I think that was one key takeaway for me. Also, we asked some questions about symptoms around sleep apnea. So sleep apnea is small pauses in breathing that happen when you're sleeping. And as our consciousness goes down when we're sleeping, the control of respiration is really important. And if there's a difference in the way that your brain functions or your tone and so on, to those small pauses in breathing. And that can be seen by snoring, can be seen by obvious pauses or gasping for breath during sleep. And about 35% of those who responded to our survey reported that their child snores or stops breathing while they're sleeping. So that's quite a lot. And about 14% said that they had a formal diagnosis of sleep apnea. Why do we care so much about sleep apnea, right? I'm a neurologist. Why do I care so much about breathing? Well, if you imagine if a child or anybody has a pause in their breathing, that can be associated with a dip in their oxygen levels. And even if it's a slight dip every time, if you have a lot of pauses, that isn't good for brain development. And it turns out that even in healthy developing kids who have obstructive sleep apnea, if you treat that sleep apnea, their behavior improves.
Interesting.
The way that they self-regulate improves. And so if that's true for a kid who's otherwise doing pretty well, I can only imagine and hypothesize as a scientist that could be even more true for a child who is vulnerable because they have had a brain injury related to HIV. So that's why I harp on this so much. Otherwise, sort of among a range of results, about a third of families reported that their child had a sleep study called a polysonogram. So for a number of these families, they've brought it to the attention of medical personnel, and they've gone through with the sleep study and had some treatment, which is good. But there's probably an area. And then I guess the last thing I'll say before I pause is in this group of responders, sleep was by far the number one research priority. That they spontaneously typed in as a response, and he said, "What are the most important things for us to be studying related to HIE. So obviously this was a group of parents who are interested in sleep, but they far and away sleep was the most important issue.
Yeah.
That they
Now, I know you mentioned sleep apnea as a large number of people reported that. What were some of the other common sleep issues reported by families other than sleep apnea?
Yeah. So other than sleep apnea, a lot of folks reported, my child has never gotten a good night's sleep. They don't sleep well through the night. And that can be a range of different things, right? They won't go to bed. They have bedtime routines and things like that. It could be they're up all night and they sleep in all day. So the natural rhythm of their body is different. That they are up because they have pain or seizures, and that certainly can interfere with some children's sleep. There was a range of things that people reported about the symptoms that their children were having.
And were you able to distinguish or ascertain in any way any notable differences in these sleep issues based on, let's say, their age or the degree or severity or range of HIE or other factors that came up?
Yeah, it's a good question. And I think one that we couldn't really answer with this particular survey.
Right.
So we didn't ask, tell me about the severity of your child's HIE. There was a range of ages from all the way through older children who were represented in this group. But we didn't try to parse out in too much detail because we weren't looking at medical records. We didn't ask a lot of details about the story of the rest of the picture of this child. So I think it's important. And one of the things when you do a survey like this is it generates new ideas and new questions that you could answer. And so, I'm inferring from you a hypothesis that, there may be groups of children who are at higher risk than others.
Right.
We can certainly talk. We have a little bit of a hint around that from the Neonatal Seizure Registry, actually, but from this survey, we don't specifically.
Okay. And I know we're going to talk about that NSR data that you mentioned too. In the meantime, before we kind of go on to that, because we talked about sleep apnea, you talked about the range of sleep issues that families communicated. What are some current interventions available that can help with some of these sleep disordered breathing, let's say, that families may want to learn about or ask their healthcare team about?
Sure. So I think the first thing is it all starts with the diagnosis, right? And so if you're concerned, my child snores really loudly, frequently, I'm worried that they pause in their breathing. That's something to bring up with your pediatrician or your neurologist, and to say, is it possible that my child has a sleep disordered breathing problem? And so there are different kinds of breathing problems that you can have in sleep. There's obstructive sleep apnea, where the child is really trying to breathe, but the air is not going in. There's central sleep apnea, where pause and sort of, you could think of it as forgets to breathe. So there are a range of different kinds of sleep apnea. So it starts with the diagnosis, and that comes from talking with a doctor. There are some surveys that can be done to just kind of screen for risk. And then the standard is an evaluation by a sleep doctor and a sleep study called a polysomnogram. So that's the first thing. And that's a lot, right? It's a lot to go through. And when you have a kid with special needs, like, do I need to do this one more thing? And so worth talking with your doctor. I would say if in fact there's a suspicion based on the story and your child's exam and symptoms, then I'm obviously biased because this is an area that I care a lot about, but because sleep disordered breathing is treatable, I do think it's worth going through the testing if that's where you are for your child. And then it depends on medical history and so on. So for older toddlers and children, especially school-age children, big tonsils and adenoids are far and away the most common reason that a child might have obstructive sleep apnea. And so if that's the case, it's pretty common to have tonsils and adenoids taken out, and it's a surgery, but it can be effective. And they're actually really good clinical trials for otherwise typical kids saying if they get treated with adenoid tonsillectomy, their sleep disordered breathing improves, but importantly, their behavior scores and regulation, sort of emotional regulation, executive function improves. So that would be a good reason to move forward with that. For younger children who don't have big tonsils and adenoids yet, there are other treatments. So sometimes they need supplemental oxygen. So we certainly have some younger who have extra oxygen when they're sleeping. And some children need more support, and there's equipment that can be provided, or other surgeries depending on the individual situation. I'd say for behavior-related sleep problems, working with a really great psychologist can make a huge difference. And so, it may be that this isn't a matter of a surgery or another treatment like that, but that working with a developmental pediatrician or a sleep-focused psychologist could be really helpful. And then there are some children who need medication to help regulate when they fall asleep and how long they sleep, things like that.
Yes.
Bottom line is there are a lot of options, so it's worth asking.
Absolutely. So let's get into future of research, or even research, not so much future things that can be happening now too. So let's go back to the findings of that survey. I guess my question is what are the next steps, or how do you plan on having that survey kind of shape future research on sleep issues with children with HIE?
Sure. So I think the survey through Hope for HIE really highlighted that this is clearly an area of emphasis for a lot of families. And so that's a personal motivator for me and for our research team. So we have already pulled together a research application looking for funding to do a large study where we can look to see, okay, how soon should we be evaluating children with HIE to see if they have sleep problems, and what impact might that have. In principle, the sooner the better makes sense, right? If you're trying to help a developing brain to develop as best it possibly can, start at the beginning. Though if you're not at the beginning stage right now, it doesn't mean that all hope is lost and you need to forget about it, right? But potentially this could be an earlier intervention. So that's a proposal that we've already submitted, and we'll see if we get funding. That will be wonderful. Funding is always a challenge, and it's very competitive. So
it's been a common theme among researchers that we've spoken to.
It's true. But I think with partnership with Hope and with really good rationale, I think we made a strong case. So we'll see. But if that gets funded, then absolutely we forge ahead. If we don't, then it's always a matter of, okay, well, what was the feedback and how can we make this a better proposal? And we regroup and we try again. So certainly the potential area for intervention and improving kids' lives will be a next set of opportunities for research. And this survey really just underscores that.
Yeah. And I know that there are a lot of contingencies, based on whether or not you get the funding or whatever. That's all the course of what those next steps look like. So this question may be a little bit hard to answer, but do you plan, or is there a role for HIE families to kind of continue to add their input as this research evolves and potentially progresses? And if so, what do you think that would look like?
Yeah. So just as we've done with the Neonatal Seizure Registry, my hope and my plan would be if we work on this exact proposal, we've already integrated parent perspectives from a couple of different advocacy groups, design and implementation. We would certainly engage with families at study centers to help with, what is the local culture around research engagement, things like that. And would be, actively recruiting children to be in the study. So I would definitely prioritize that patient family engagement throughout, just as we've done successfully with the Neonatal Seizure Registry. And so it'll just be a matter of, do we get that funding, and which centers are up and running when, and which families are ready to go to help versus ready to go to enroll their children. And so it will be a collaborative effort, though, no matter what.
And you previously mentioned some or referred to some NSR work that on sleep in school-aged kids who had neonatal seizures. Can you kind of expound on that a little bit more for our community members and tell us what that's all about?
Yeah, sure thing. So the Neonatal Seizure Registry started recruiting families for a study of how long seizures need to be treated with medicines back in 2016 or so. A little bit later than that, 2017, 2018, people really were enrolling. So those kids are now school age. And we were able to get funding from the NIH to do assessments of those children and their families once they were getting to school enrollment in first, second grade kind of ages. And one of the things that we included when kids were 5 years old in our big survey packet was a couple of surveys that are evaluating sleep. And so we have a little more than 100 families who have responded to widely used, well-validated surveys around sleep habits and sleep behaviors and around sleep disordered breathing. And about half of those families are families whose child had HIE. So it's not just HIE, but a large chunk, as is true with most studies of neonatal seizures. And what we found was 2/3 of those families reported that their child had abnormal sleep based on something called the Children's Sleep Habits Questionnaire. So 2/3 of children scored higher than the sort of the abnormal threshold on that survey, and about a quarter of children screened positive for sleep apnea on a apnea focused survey. So that just tells us, gosh, this is clearly an issue at age 5. We didn't go deep on, okay, well, what evaluation have we had and those sorts of things, but clearly at this age of about entering sleep issues were really prevalent. When we look at a subgroup of children with cerebral palsy or a subgroup of children who have epilepsy, they have even higher numbers of sleep issues. But I think really importantly, there are a lot of kids who otherwise seem to be doing pretty well, whose families are really concerned about their sleep. And so what this raises for me is, gosh, maybe we as clinical providers need to be proactively asking the question, how is your child's sleep? Are they snoring? Do you have issues around going to bed, falling asleep, staying asleep, things like that? Because if 2/3 of our family that this is a problem, that's enough that we probably should be asking everybody.
Yes. Yeah. We always like to end our Q&A sessions with just asking our professionals what's a good list of recommended resources that you have that you could give to parents for helping understand and navigate sleep issues. So anything you have to share, we'd be grateful.
Absolutely. So I think the first thing is talk with your doctor or your nurse, right? Talk to your pediatrician or family medicine doctor. Talk to your neurologist or your pulmonologist. And if you're worried about your child's sleep, bring it up. And heartbreaking to me, but reality is, we had Hope for HIE families on our survey saying we got blown off or brushed away on our sleep concerns. So I would encourage you, if it's really a problem, bring it up. So that's the first thing. And then know that there are trained specialists in pediatric sleep. Now, they're rare birds. They're very specially trained. And oftentimes they have a long wait list because sleep problems are really common in kids, but that's okay. You can start on a wait list. So that's one first thing. And then, the good news is that if you have to look at a glass half full, since sleep problems are really common in kids in general, the American Academy of Pediatrics, which focus on all children, has some really great resources for parents on their websites. If you look at healthychildren.org or look at American Academy of Pediatrics and Sleep, you can find really good information about safe sleep practices, right? For infants, really important, right? Sleeping on your back, sleeping with nothing else in the crib, things like that are really important. Sleep behaviors, what do I do if my child misses bedtime? Some basic things like that, all the way up through, let's talk about sleep apnea. So I would refer you to the American Academy of Pediatrics. There's also a website called babysleep.com that has a lot of good information about sleep in infants in particular that I refer my families to.
Thank you so much. As always, we appreciate your expertise and your contributions to our community. And we can't wait to kind of hear about what the next steps of all of this looks like. And, we cross our fingers for that funding, et cetera. But we just thank you so much for your time and your willingness to kind of meet with us. And for those of you who maybe are not familiar with the process, this video will be posted on our YouTube channel. Obviously, you can find it on our Facebook pages as well, an Instagram page. But we'll also turn it into a blog for key takeaways and et cetera, et cetera. So you'll have a lot of resources to look at in the next couple of days that kind of surmise what we talked about here. But once again, Dr. Renée Shellhaas, thank you so much for joining us. And we look forward to your continued support and partnership.
Thank you so much. And I'm just really, really grateful for being able to partner with Hope for HIE. The work that you're doing is really inspiring. It's making a huge difference. So thank you for including me.
Thank you so much. All right. Goodbye, everybody.